Hi everyone, welcome to our Webinar Wednesdays. I'm your host Daz Lopez and I want to thank you all for joining us today. Today's speaker is Dr. Sharon Kim and she will be covering how to care and protect your skin during the upcoming summer months. Dr. Sharon Kim is board certified by the American Board of Dermatology. Her clinical interests include general dermatology, pediatric dermatology, skin cancer, and both surgical and cosmetic derm. Dr. Kim joined Kelsey-Seybold in January of 2019 and is currently practicing at the Clear Lake and Pasadena clinic locations. For information on Dr. Kim, please visit Kelsey-Seybold.com. As a reminder, we'll be taking any questions you have at the end of the presentation. If you have a question, please just type it in the question box and we will do our best to address it at the end of the presentation. With that being said, I will turn it now to Dr. Kim.
Hi everyone, I'm Dr. Kim. I'll be giving this presentation. So let's talk about our skin. So as everyone pretty much know, it is our largest organ in our body. Some say it's the most essential, but that's debatable. Our skin is actually very complicated. It has 7 layers of tissue and it makes up the outer shield of our body. Its main function is to create a barrier between our organs so that our inside and the outside will be separated. It also helps regulate our body temperature and it protects you from dehydration. So our skin is our body's first line of defense. It filters and protects you from harmful bacteria, other types of viruses, toxic substances, cold, and the sun rays. Your skin plays such an important role in your health that if you don't take care of it, you may get sick and even also get skin cancer. So no matter your age, skin color, or skin type, skincare is very vital to your health and beauty. For instance, if you get chronic or intermittent sun exposure, it may increase your risk of getting skin cancer. All right. So there are 3 ways to prevent skin damage. Number 1, protect yourself from the sun. The sun is the #1 cause of skin damage. Number 2, you want to treat your skin gently. And number 3, have a daily skin regimen so that you can keep your skin healthy. Taking care of your skin and developing a skincare routine maintains your skin health. It's not just cosmetic. Having healthy skin is a lifelong process that requires daily diligence. Our skin sheds itself every day, so you need to have a consistent daily skincare routine. And remember, prevention is much easier than having to treat in the future. If you want healthy skin many years from now, the choices you make today will make that happen. All right, the #1 thing you can do for yourself is protect your skin from the sun. So let's talk about UV rays. So UVA and UVB are from the sun, and they actually both cause sunburn, skin cancer, and aging, premature aging. And some people don't know this, but getting too much UV ray can actually suppress your immune system. Yes, we do need UV rays to get our vitamin D level, but you only need less than 15 minutes a day to accomplish that. So we usually say, as dermatologists, take a daily supplement of vitamin D instead of trying to get it from the sun, since the sun has harmful UV rays that cause skin cancer. So 80% of our sun exposure occurs before the age 18. So it is so important to put sunblock on your children. Just 1 or 2 blistering sunburns may double the risk of developing melanoma. But it's not too late to wear sunblock if you're over the age of 18. It's never too late. Your skin can actually self-heal, and they found that wearing sunblock still does prevent skin cancer after the age of 18. So how should we protect ourselves from the sun? 3 things that we can do. Wear sunblock every day. You want an SPF of at least 30. and you want it to be broad spectrum, so it can block both UVA and UVB. You should put it on 20 to 30 minutes before sun exposure, and make sure you're putting it enough on your body. If you're going to be outside, reapply every 2 hours, or every time you sweat, put it on an hour, hour and a half after that. Make sure that, once again, you're putting enough of your sunblock. And your makeup that has SPF in it is not enough. It does not replace the sunscreen. Okay, so number 2, seek shade. You want to avoid sun exposure between 10 a.m. and 3 p.m. if possible. That's actually longer in Houston, but please keep in mind that you don't want to be out in the sun during that time, because the UVB is actually very strong during those time period. And also drink lots of water, not because that actually protects you from the sun, because when you're outside, you do dehydrate. You can become dehydrated. Okay, so number 3, wear protective clothing. You want to wear a wide brim hat that covers your ears, and you want to wear sunglasses. Also, loose fitting, light color clothing is best so you don't overheat. And there's a lot of UV protective clothing that now you can get at the store, and it has UPF on the label. The laundry additives, yes, you can do that, but I don't think that is so necessary. All right. So choosing the best sunscreen, I think that's one of the most common questions that I get in my clinic. There's no one sunblock that works for everyone. You need to find one that fits your skin type and the one that you're going to use every day. So make sure it's at least SPF 30 and that it is water resistant. If it's water resistant, that means that it will protect up to 40 minutes. If it says waterproof, it actually means it will protect up to 80 minutes. So you got the labels, they do have meaning, and you do want to read the labels. And I talked about this already, but you want to put enough before you go outside. Sometimes people don't put enough on their skin and they still get sunburned. And the broad spectrum, it should say it on the label. And then my favorite is physical blockers. So you should have titanium dioxide and zinc oxide. So those are mineral physical blockers found in sunblocks. Some sunblocks, some sunscreens don't have these in there, and they're chemical sunscreens. They go on better on the skin and they look nicer on the skin, but they tend to cause allergic reactions. They can also burn the eyes. So look for physical blockers, and you can see that by turning over the sunblock and looking at the active ingredient. So some suggestions: Ulta MD is a good brand, and SkinCeuticals. Those brands, however, are only found in doctors' offices. So if you want to get the drugstore brands like Neutrogena, CeraVe, Cetaphil, Aveeno, that's fine. It just has to be broad spectrum, SPF 30 or more. Okay. All right, let's talk about the forgotten 5. So these are 5 places people forget to put sunscreen on, and this is where they get some sunburns. So your hair, the scalp, that's still your skin, and the UV can go through your hair and cause skin cancers there as well. And I see plenty of skin cancers on the scalp, and they are very tough to remove, and it is a very painful process if you get some skin cancer there. So make sure you put sunscreen in the part of your hair, especially for women. A lot of women do not change their hair part for many years, and then I actually see skin cancers along the hair part. So move the hair part once in a while and make sure you're putting some sunblock onto your scalp, not on your hair, but your scalp, and then wear a hat on top of that. Okay, the sides of your face. People forget to put sunblock on the sides of their face, and they only put it on the central part of their face. So make sure you're covering your face and your ears. And then the base of the neck, especially for people who have short hair, you want to make sure you're covering the whole neck. Oh, I'm sorry, the number 4 is neck and chest area. And actually, one of the places that a lot of my patients complain about is sun damage on their chest, because they don't they didn't put on sunscreen on their chest, and it goes through your shirt. So you see a lot of sun damage on the chest, and I see premature wrinkling, sunspots, and skin cancers, especially on the neck and chest area. And then the feet, the tops of your feet, don't forget it, put it there. And a lot of people have had sunburns on the tops of their feet, so don't forget to put it there as well. Okay. All right, the second thing you can do is to treat your skin gently. So you never want to overwash, and you never want to use strong soap. Sometimes people overwash their skin thinking that they're dirty. You want to treat it gently. So you want to limit bath time and avoid hot water. You want to use lukewarm water. Hot water overstrips the skin's oil and causes a lot of irritation. Strong soaps. So some examples of that: Zest soaps, all of those bar soaps that we see at the store, those tend to be a bit too strong for our skin. And also shave carefully, pat your skin dry, don't rub it. And as soon as you come out of the shower, that's the best time to moisturize your dry skin. So we're going to talk about it a little bit more. So limit your bath time. I always say 10 minutes or less. Don't do hot water. I know it feels good, but you want to avoid that. And then the strong soaps. So avoid those Dial soap, the Zest soaps. They're too strong. They're like laundry detergent. It takes away all that oil, and you don't need harsh soap to be clean. You want to stick with mild cleansers. Okay. So let's talk about shaving. You want to use a clean, sharp razor every time you shave. Also, go in the direction of the hair growth, not against it. My favorite shaving cream is actually the Vino shave cream, and I have no financial relationship with them, no conflict of interest. But the reason why I like it is because it has oatmeal in it, and it doesn't have fragrance in it. And if you use the wrong shaving gel or a dull razor, you can really damage your skin. And I do see that a lot in my clinic. I even saw a patient who developed an infection in his beard area because he was not using a clean razor blade. So please make sure you're doing that. All right. So when you come out of the shower, pat your skin dry. Don't rub it too hard. Always treat your skin gently. And like I said, as soon as you come out of the shower, you want to moisturize your skin. That's when it's easy to put on your moisturizer, and it goes on well, and it replenishes the moisture that you kind of lost with washing your skin. And in the morning, you want to consider using a moisturizer that contains SPF, so that can make it, you don't have to do 2 steps. You can just do it in 1. Okay, skincare regimen. My second most common question that I get in the clinic. Everyone's different. You have to find the products that work for you. But in general, you want to use a cleanser because that removes your buildup. You want to moisturize your skin. It doesn't matter if you have oily skin, you want to moisturize it because it keeps your skin healthy. And then, of course, wearing sunblock every day. Okay. SkinCeutical is a brand that I do like. It is a bit expensive, and it is sold in doctors' offices, but it's good for sensitive skin, and they have a whole line. They have cleansers, moisturizers, antioxidants like vitamin C, and then sunscreens. But you don't have to get SkinCeuticals to have a good skin routine. This is just one brand out of many that's good. Okay, so in general, this is what everyone should try to strive to do. Wash your face with a gentle cleanser using lukewarm water. As soon as you do that, pat it dry, and then put an antioxidant serum over that. You always want to put serum on first. It's the liquidy gel-like serum is basically, that's how it looks. It's that liquidy substance found in dark colored glass. Mixtures in a dark colored glass, because most antioxidants do degrade after being out in the sun or getting any light in it. And after you put on your serum, you want to put on a moisturizer with SPF 30 or more. And if you do wear makeup, put on your makeup last. So you always want to put on your SPF last before your makeup, because that's what's closest to the sun and that protects your skin. Of course, you don't have to do an antioxidant serum. That's if you want to. What's really important is washing your face and then putting on your SPF in the morning. At nighttime, you want to wash your face again with a gentle cleanser. And if you want to put on a retinol on your face for anti-aging reason, then you can. I do have to say though, if you're pregnant, nursing, or planning to become pregnant, please do not put on retinol. And retinol is basically vitamin A. Different Gel used to be a prescription acne medication, but now you can get it over the counter. It's for acne, but it's actually also works for anti-aging purposes. Once again, do not use it if you're pregnant. And after you put on your retinol or vitamin A, you can put on a moisturizer if you're still dry. Okay. All right, so we can talk about aesthetic treatments. So aesthetic treatments is cosmetic. They're not covered by your medical insurance. Another common question. It's optional and not medically necessary. So if you wanted to get some anti-aging procedures to kind of help with the aging process, so you can rejuvenate your skin. These are some examples of things you can get done in our office. Chemical peels, fillers, Botox, and microdermabrasion. Discussing these treatments though, we will need another presentation. Not everyone needs this treatment, so you do need to consult one of us to see what you need. And I also want to say, you do not want to go to med spas for this. Nowadays, anyone with any credential or no credential at all can pretty much do these treatments now. But really, you pay for what you get, and you don't want to mess the skin that you got, and you can, and it can be dangerous. Fillers can cause blindness. Chemical peels can actually cause permanent scars. So please be careful with this. And like I said, this is all optional. Okay, so last slide, I believe. Please visit your dermatologist once a year for your annual skin cancer screening. That's when we do a skin check head to toe, and we're looking for skin cancer. And that's the main reason. We're looking for anything that looks suspicious for skin cancer, pre-cancer, or anything that can cause you trouble. It's really important, though, that you do your own self-skin check once a month. And that's looking head to toe, your feet, your hands, your buttocks, your genital area. I know it's hard to see your scalp, but try to look at your scalp. You can get skin cancer anywhere you have skin. And I've seen it pretty much everywhere on the body. You don't have to be a dermatologist to know what is skin cancer or not. But if your spots are changing, bleeding, or growing, those are signs that it could be skin cancer. And also, if you're getting any new moles, or especially after the age of 30, then please come and see us. And if you detect skin cancer early, that's the best thing to do. You can prevent getting chemotherapy or metastasis of the skin cancer if you detect the skin cancer early. So that's what we want. We want to get them early. All right. So that's the end of the presentation. Does anyone have any questions? That's it. Oh. Okay, the first question that I got, and I'm going to read it out, is, okay, so I work out in the field year-round and during normal business hours, the hottest part of the day. I know sunscreen is essential and wear it every day. However, because of the constant sweating during the summer and limited access to facilities, it's difficult to constantly reapply. Any recommendations for sunscreen and avoiding fungal skin infections? Okay, so 2 questions. Yes, I understand it is very difficult to reapply sunscreen when you're sweating and you don't have access to a sunscreen. So try to get a water-resistant broad spectrum sunblock. Um, put that in the morning before you go out to work. And then on top of that, spray your skin. So put on the cream, the sunblock, that's a cream or a lotion form, and then spray yourself with the sunscreen spray, and then wear the sun protective clothing on top of that. And the sun protective clothing actually feels nice and airy because it blocks the UV, which makes you hot. And then throughout the day, maybe you can spray yourself with the sunscreen because I know it's really hard to apply. Neutrogena, Ulta MD, they both make a sunblock in a cream form and then the spray. To get the sun protective clothing, you can go online. Coolie Bar is one. And then, you know, even if you can't be perfect with your sunscreen, just try to do it as often as you can. And you want to get the ones that are water resistant. Okay, avoid fungal skin infection. Try to keep your skin dry. If you tend to get frequent fungal skin infection, you can use the over-the-counter antifungal spray or powder and pat that on the areas that tend to get the infections there. And then when you come home, wash your skin with soap and water and then pat it dry. And then don't wear socks or clothing or, you know, don't cover it up. You just want to always keep it dry because fungus loves moisture. All right, next question. Any recommendations for removing blackheads or using toner in your daily regimen? Toners, if you want, you can use, but it's not really necessary. If you tend to get frequent blackheads, you can use toners that have salicylic acid or glycolic acid in it, and that can kind of help kind of dislodge the blackheads. But you may need to see an esthetician or one of us and have them removed. And please use that different gel that's over the counter that can help remove the blackheads. But it takes daily use of these products to really see the blackheads to go away. And it's not a one-time thing. It comes right back if you don't use the right products. Chemical peels can also help remove some of the blackheads as well. Okay, third question. When is the best advisable time to wait when applying moisturizer after retinol at night? Great question. So the recommendation is that you put on retinol on dry skin right after you wash your face and then wait a few 20 minutes to put on a moisturizer. But who has that time? So just put on, what I do is I put on my retinol on and then I put on the moisturizer right on top of it. It kind of prevents irritation anyways and kind of makes my nighttime routine better. Sometimes if your skin's really sensitive and dry, you can put on the moisturizer first and then the retinol. So that makes the retinol ingredient, active ingredient diluted, but a little is better than nothing. So whichever works for you and your skin. Okay. Next question. Is skin cancer harder to detect on African Americans? No, I don't think it's harder to detect because skin cancer acts the same. It bleeds, it changes, it grows. But it's not detected as often in African Americans or Black individuals or people with darker skin because, first of all, they don't think they get skin cancer, and so they don't protect their skin as much, and they're not looking. But everyone can get skin cancer regardless of your skin color. The common places that you get, African Americans get melanoma is their hands and their feet. So make sure you're checking those areas. But everyone should see a dermatologist if you have a mole that's bleeding, changing, or growing. Okay. If I have a recurring small lesion or lesions every 4 to 6 weeks on the back of my scalp, upper neck, is that a possible infection? Probably not. If you're getting it every 4 to 6 weeks, that probably sounds like a chronic inflammation issue. But that's something that needs to be evaluated in the office for sure. If you're getting a lot of discharge pain and if you have a fever, yes, you could have a possible infection, but you definitely need to see someone for that. Okay, next question. How much is microdermabrasion? I do not know how much that is because we do not do that in the office. That's usually what estheticians do. Microdermabrasions kind of help with temporary smoothing of the skin, but it's not necessary for your skin health. That's an optional cosmetic procedure. And a lot of med spas actually do it. And that one I'm actually kind of okay with them doing because it's superficial, but please go to a reputable place. Yeah, but we don't do that here. It's like getting a facial pretty much. Okay, another question. What's the best way to keep the face from being oily? I've tried so many products and when I wear makeup, they don't help. You may need to come and see one of us and be placed on some kind of medication, oral or topical, so you're not as oily. But some people are born with oily skin. They have enlarged numerous oil glands on their face, and so it's really hard to keep that at bay. You want to stick with oil-free products, more of a gel products. So want to avoid ointments and creams. You want to stick with some gel-like lotion. Yeah, that's a long question. It's a short. I can talk about this for a long time, but basically, you want to avoid heavy products and just stick with light products. And you may need to see one of us, one of the dermatologists, to discuss how to kind of help with that. Okay. What is the benefit of Excision versus Mohs? So they both treat skin cancers, but Mohs is appropriate. So Mohs is not done for every skin cancer, and it's not appropriate for every skin cancer. So let me give you an example. If you have a very large melanoma, you will not get Mohs. But if you have a skin cancer on your face with the appropriate size, then Mohs is the best thing to do because it's a technique where they take the smallest amount of tissue, trying to preserve the tissue that you have or the skin that you have to give you the smallest scar. So let's say you have a basal cell on your nose, you don't have much skin there. So they check it in real time as they're doing the skin cancer so they can take out the least amount of the tissue, get it clear before you leave, and then close it up. And then they also do reconstruction. But if you have a basal cell on your arm or your back, you have a lot of skin there, so you don't need to do Mohs where they check it in real time and try to have a small scar. So that's the difference between Mohs and Excision, but they both treat skin cancer, and your dermatologist will be able to recommend one versus the other. Okay, can we get a copy of the presentation? Yes. Okay. Another question, do you have an over-the-counter recommendation for helping with dark spots? I like the SkinCeuticals serum for dark spots. They just came up with a new one. I also like vitamin C serum that they have, but it is kind of pricey. So if you want to get La Roche-Posay, CeraVe, that's in Walgreens. So you want to find products that have vitamin C in it. I do have to say though, a lot of these over-the-counter products that have hydroquinone in it, so hydroquinone, if it has that in there, then please be careful. It can actually cause permanent darkening of your skin, and which is called ochronosis, and there's no treatment for that. So I've seen a couple of patients who've used over-the-counter products with hydroquinone in it, and they permanently darken their skin. So I usually say stick with vitamin C serums, and please wear sunblock as well. Okay, next question. What would you recommend as the best moisturizer for controlling eczema? Elatone or CeraVe? Elatone is so expensive. I actually like Vanicream, VANICREAM. You can get that at Walgreens. It doesn't have harsh chemicals in there. It's pretty simple of ingredients, and so it's really good for sensitive skin, not just for patients with eczema, and it doesn't burn the skin. So Vanny Cream with the V. What SPF is recommended for dark African Americans? Well, I usually just say everyone should wear 30 or more. Just make it easy. Just want to get 30. Yes, if you have darker skin, you have more melanin, but wearing sunblock will still help prevent dark spots and skin cancer. So 30 for everyone. Okay, regardless of your skin color. All right, next question. Would you recommend clear and brilliant treatments for sunspots? Depends on what kind of sunspots, how severe, your skin color, what have you done. So yes, it can work for some people, but it's not a treatment for everyone. So the person who's doing the clear and brilliant treatment is actually a laser treatment that you see a lot online, and a lot of clinics have it. You want to make sure you go to a person who is experienced using the laser in all lasers, and you want to make sure they're a board certified dermatologist who's doing it. You don't want someone who got a weekend course on it to do your skin, because lasers can burn your skin and cause permanent scarring. And though it looks easy, the person who's evaluating your skin should know if it's going to work for you, how to use it, how frequent. So a lot of thinking goes involved with recommending laser treatments. So you want to make sure you're talking to the right person and you're getting it from the right clinician. Okay. Okay, so next question. Any products that could help with skin elasticity after weight loss? No cream is going to help with that. I'm sorry. It's just not, it doesn't, no creams goes to that layer of the dermis to bring back the elasticity. It just doesn't work. You would need to do procedures for that. All right, so next question. Is it Lumiviv? I've never heard of that. I'm not sure what that is. But what is the best way to treat underarm darkness? If it's hereditary, it's a bit tough to do. If it's because you've used the wrong product and then you got post-inflammatory hyperpigmentation, you can use over-the-counter dark spot remover creams to help with that. But once again, you want to avoid hydroquinone, or you want to use hydroquinone for only a few months at most. But yes, it depends on how dark it is and if you were born with it or not. But in general, you want to avoid dark spots. Oh, okay. Okay, so I'm going to do my last couple of questions and then we're done, okay? Is it typical for large moles to itch and hurt? No. If your moles start to become symptomatic, it could be a sign that there's something wrong. So you do need to get that evaluated. Is removal recommended for large moles? Depends. If the large mole hasn't changed and you were born with it, completely fine. But if your mole is changing regardless of the size, then yes, it needs to be evaluated and biopsied. Okay, let me see. The SkinCeutical product, I think it's called for dark spot remover. And one's called Floritin and the other one's vitamin C and E. And no, I do not think collagen powders and supplements work, so please do not spend your money on that. Okay. Oh, I'm sorry. Last question about discoid lupus. That's important. Okay, if you have discoid lupus, you want to get as much protection as possible. So yes, SPF 30 and SPF 100, there's not much of a difference percentage-wise, right? Maybe 1 or 2% more. But if you have discoid lupus, that means you're very, very sensitive to the sun. Maybe the SPF 100 will help just a little bit. Maybe it's a marketing gimmick. It's hard to say. But if you can get a higher SPF and with mineral zinc oxide in it, then please use that. You want to get as much sun protection as possible. Okay, that's it.
Alrighty, thank you, Dr. Kim, for such an excellent presentation. We want to thank you all for all the questions over skincare. This will conclude our webinar. I want to especially thank Dr. Kim once again. And also be on the lookout for our next webinar, which will not be until August. So have a safe and happy 4th of July. Thank you.